As you all know, migraine is a very common headache and it produces a lot of impact in everybody whoever has got it. It's the 6th most disabling condition in the world. And almost everybody would have gotten headache at least once a year. 38 million Americans get migraine. It's a large number, and 1 billion people worldwide get migraine. So you can imagine, one followed by how many zeros people are getting the migraine. It usually lasts about 4 to 72 hours most of the times, sometimes a little more when it's known as status migrainosus. If it occurs for 15 days or more in a month, then it becomes chronic migraine. And over 4 million people get chronic migraine, and 90% of them do have a family history of migraine most of the times. So I'm going to talk to you about Mrs. P, who's a 42-year-old lady who is working in a software company. Because of the lockdown, she is working from home. And her complaints were that her migraine headaches have worsened. And I asked her to describe the headache. She said first she has some visual flashes few minutes before the migraine. And she says it's very disabling because it just keeps flashing around. Then after that she has a headache, usually unilateral, but as time goes through it can become both sides also. Then she gets that nausea, vomiting, which is very disabling, and photophobia. She doesn't want the children or anybody at home to make any noise or put on lights. And if she walks, she feels worse when she climbs the stairs. And each one, she says, lasts for about a day and a half and about 4 to 5 days in a month. And all this is worsened by lockdown, because here what happens is everybody is at home, the whole family is at home, and her schedule is not very regular. Because all of them get up at different times of the day, and the eating schedule is all changed, and this migraine attack gets precipitated when she is under stress. As she has to work from home, the stress of maintaining the family, the feeding the children and doing the household chores had become a very stressful situation to her. If she goes to office, then it's all very disciplined. 8 o'clock she finishes her household work, she goes to office, works and comes down. But now the children have got online classes, though they get a plate, they do not have their food on time. So she is not able to eat on time, and all these had worsened her headache. That's when she saw me, and then we had an MRI done and it was normal. So she wanted to know what type of headache it was. So I had to explain that there are 2 types of headaches. One is the primary headache. Usually the neuroimaging is normal. In that we have the 4 types. One is the migraine, second is the tension type headache, third one will be the trigeminal autonomic cephalgias, and another one is the other primary headache disorders. So in that, the migraine is number 1. This is the classification by the International Headache Society, and these numbers indicate how it is being classified. Migraine without aura is 1.1 and migraine with aura is 2.2. She fits into the migraine with aura because she has visual aura, and which lasts about a few minutes, 5-10 minutes, after which she has an intense headache. Then you have the chronic migraine when it lasts for more than 15 days in a month. Complicated migraine has a different varieties, probable migraine and episodic syndromes that may be associated with migraine. I am going to go only into the regular migraine. So migraine without aura is you should have at least 5 attacks which will fulfill this criteria from B to D. So what is this B to D? B is headache attacks lasting 4 to 72 hours. So usually these attacks last 4 to 72 hours if it's untreated or unsuccessfully treated, and they can have 2 of the following 4 characteristics, which can be unilateral in location, pulsating in quality, moderate to severe intensity, aggravating by or causing avoidance of routine physical activities like walking and climbing. These can aggravate and patient will try to avoid these activities. And during the headache, you should have any one of these: nausea, vomiting, photophobia or phonophobia. And this should not be accounted for by any other ICD-3 diagnosis. So what do you find here? Here she's got an aura, but her headache is lasting 4 to 72 hours and it's unilateral, later becomes bilateral. It's moderately severe and aggravating by walking. She's got nausea, vomiting and photophobia. So is this her migraine? Let's see what the next one is. This is with aura. Here it is almost similar, but here the aura is present and this is a reversible aura. And usually it lasts for more than 5 minutes. And each individual aura maximum will be about 60 minutes, and within that 60 minutes it will be accompanied by headache. Aura can occur and can proceed on with the headache. Aura can occur, can have some free time from the aura, and then you can have a headache. So she has migraine with aura. When you say that, then how disabling will this be? Because what happens is, in a migraine headache, it is not just the migraine phase which is disabling. What happens, you have a prodrome which can last for a day or two before, few hours to a day or two before the headache, when they know they are going to have an impending attack. In the sense, they may feel irritable, restless, they do not know, they don't sleep well, and then after that they develop an aura which lasts about anywhere between 5 to 60 minutes. Followed by that the headache, which can last a maximum of 72 hours, which is about 3 days. Then after that there is some tiredness, which can be a prodrome, that can vary with the individuals. So, I am showing you different types of auras. See, here you can see just one bright light, and here this is a positive scotoma, is white, and here you can see the flickering auras, which is very characteristic of migraine.